radiation duct is, don't become a quick pincushion. That's all I'm trying to tell you. So it's the same blood work.
The Metaport. It's gonna be something where you can draw the blood out from him, and he's gonna have it, and that way it's not gonna
The
be.
Metaport, it's in his chest.
Okay.
Okay, it's gonna be somewhere like here and or over here, whatever they're gonna put it on.
Okay.
Which side? It's a device which underneath the skin is nothing sticking out. The only people who can do the blood work from a Metaport is the nurses. So when he's gonna come for the for the chemo, like I said, first time we don't need it because obviously they're gonna do a bunch of blood work anyway, and we can share. We can grab that blood work from them. They can send us result. That's not a problem. But after that, every week he's gonna have a blood work. So he can, if they have a really difficult times with the veins, yes, just tell the nurses that can you please draw my blood through Metaport, and they will do it. They just put the needle in, get the blood, and that's it. And they can use. They're gonna put the catheter in because he's gonna get chemo anyway. So he doesn't have to get like, it's not like poke and poke. It's just like one-time deal kind of things. Okay. So if they have a hard time about it, just let the girls know. They're very nice. Sometimes they get very very busy, but we'll try to work it through. Okay. So anyway, that's about your chemo overall will last about I'm gonna say about 3 hours. I'm being more general. Taxol takes 1 hour to infuse. Carboplatin takes 30 minutes to infuse. That's hour and a half. And then you're gonna get some medication to anti-nausea medication to prevent nausea, and medication to prevent allergic reaction. It's a 2 histamine blockers, H1, H2. It's a Benadryl and Pepcid. So said that allergic reaction. What are you talking about? I don't know if you're allergic to Taxol or not. A lot of not most people, some people can be sensitive to Taxol. The reaction usually what happen reaction can happen with the first or second treatment. What kind of reaction? You can feel chest pain, you can feel shortness of breath, you can feel back pain, you can feel itchy, scratchy, any kind of like unusual kind of feeling. It doesn't mean that it's going to happen. I just have to tell you that it could happen, and it's usually it's usually not to actual chemo. It's usually to preservative and that drug. And if it happens, the girl's gonna stop everything, reverse everything, give them more steroids, give them more Benadryl, everything's gonna get reversed. Then they're gonna wait about until basically your body is gonna like release some toxins, and then about when everything goes back to normal, about 30 minutes to an hour, we're gonna restart the treatment. If you the one who is sensitive to one of those medication like Taxol specifically, then we're gonna give you some medication to take it before you come over here for next treatment.
So you're not asleep?
No, you're not asleep. No, you're not asleep. You're gonna be, oh, you might be sleepy. You're gonna get Benadryl. Yeah.
I'd rather be asleep. I don't want to feel nothing.
You're not gonna. What do you think we're gonna do to you? We're not gonna. This is.
I feel like a guinea pig.
A guinea pig? No. As a matter of fact, like you're not even like if you're not gonna have a reaction, and most people don't. You're not even gonna know what's kind of. You're gonna be fine. You're not gonna feel anything. The diet and everything else comes later, and a lot of side effects he's gonna experience because it's esophageal. Some of them is going to be from radiation because when and it's not right away anyway. It's going to be like way down the line. I am not going to talk about radiation. So, you need to stop pushing me in a different direction. Felix, we're going to get lost. I know, I can see that.
I used to weigh almost 300 pounds. Now I weigh 168.
Now you're disappearing. We gotta get you back.
I went back to when I was 18 years old.
Let's get you back. Okay, let's talk about the cells. let's talk about the important stuff. So anemia, one of the common side effects with the chemotherapy, anemia, because we're gonna, even I said that your chemo is like low dose sensitization kind of chemo, help radiation work better, it's still attacking the cancerous cell. And not just the cancerous cells, it's attacking the nice good cells. We have a red blood cell, white blood cells, so that's where the side effect comes from. So you can become anemic, a little bit weak, a little bit short of breath, you still have a chemo even if you're anemic. The most important cell for us to watch is going to be your white cells. White cells fight infection. If you don't have enough white cells, you're prone to infection. So your goal to be protect yourself from everybody else, because even between radiation and chemo, your white cells are going to be not as strong as my white cells. If your white cells become low, most likely we're going to try to keep you on the schedule with the chemo because it's important. It works with radiation. It is a magic shot. It's not a magic shot. It is a shot to boost your white cells production. It's called Zarzio. So if his white cells go down, most likely he's going to get a shot. It's called Zarzio, and he can. It depends where the count is. It can be before or the day after. It depends, but it is help to boost those white cells up. If your white cells are low, you're prone to infection. Do you take care of any cats, pets, dogs, fish tanks? None of those. Good. Don't worry about. If you have a little grandchildren who's sniffing and snuffing all over the place,
They're not gonna come around. So basically,
the-
it's gonna
it
be.
just-
It's just about. There's 4 adults in the house. My dad will be in his area, and my son, and usually just
careful.
normal.
Yeah, I'm just mentioning just careful because your white cell. Any fever greater than 100.6, we consider fever. You need to let us know. Low grade fever, a lot of people say, oh, I like 99, whatever. A lot of time it's because you're not drinking enough fluids, and we're going to get to it. You just need to step up and drink more fluids. However, which you are coughing, but I'm talking about if you're coughing and bringing up some green, or if any changes, any kind of symptoms of infection, then you need to let us know. Going to the bathroom every 5 minutes and voiding small amount or intense amount, and it's burning, could be UTI. So it doesn't matter what it is. They put Mediport and it's look red, it doesn't look right. I don't care what it is. Basically, you have to remember your white cells need to fight infection. If you don't have enough of them, you can be prone to infection. Sometimes you need to let us know. Sometimes we need to evaluate. You might need antibiotic. You might need something else.
You got it?
Thrombocyte.
Do you understand?
You understand, I'm just listening. I'm just wondering what's gonna happen.
That's why I'm here. If you have questions, you can ask me, and I'll be more than happy to answer you. Thrombocytopenia, that's a big fancy word.
Poking on me every time.
I'm not gonna poke on you.
Well,
I'll let somebody
take
else.
blood. I hate that.
Tramadol?
Tramadol?
No. The last medication that you're gonna talk about.
Taxol or carboplatin?
No. I'm sorry. You were gonna maybe the Traxmopatin.
No. I was gonna thrombocytopenia.
Yes,
that's not
that one.
medication. That is not a medication. I'm gonna tell you. It's like it's a fancy word. It's saying about platelets. Your platelets.
Okay.
Yeah. I was like, because you're gonna sign this that I talked to you. I was like, I don't know what the heck was that. I was like, oh, it's platelets. So your chemo can affect platelets. If your platelets are low, is no magic shot for platelets. If your platelets will be affected, and if they're really low, we would just have to postpone the chemo completely that week. Would he get radiation that week? I don't know. That's going to be up to radiation doctor. Do you have to make up the chemo which have to be postponed? No, you don't. Just letting you know that. Okay, because chemo with radiation. So if your platelets didn't make it, oh damn, they didn't make it. So they will make it next week. A lot of time it's probably won't even happen, but sometimes it does happen. They kind of slow to go down, but then sometimes they slow to go back up, and sometimes we gotta give them time to recover. There's no magic shot to boost them up. There's no magic food for boost them up. There's nothing else you can do to make them feel better.
They just recover.
It was just gonna recover on its own.
Okay.
Yes, you're gonna lose your hair, and when I'm talking about your hair, it's.
Oh, I get it.
I'm not talking about your head hair.
Hmm?
I'm talking about wonderful.
Well, I might as well check it off.
Well, then you could just hold on to it. Don't wait. It might, you might keep some.
I
You
don't
might.
wanna see it fall right
Oh,
away.
it's up to you, but it might, when you're gonna feel like it's coming out, then you can shave it off because it's very pretty right now. So, but it will come off Taxol
No,
and
mustache
Carbo will
too?
take it off. Everything, any hair, pubic hair,
Might as well check
any
it. I'm gonna check everything off.
any hair,
Hmm.
and
I'm
that's.
gonna look like
I'm just trying to save you money on the razor.
Okay. But I'm just trying to, I don't, might as well check it off.
Now, talking about razor, if your platelets low,
Don't shave.
please don't shave.
Be very careful not to be
very
cutting.
careful not
Yes,
cut
ma'am.
yourself. So that's
Oh, yeah.
yeah. You don't want to do that because platelets are responsible for bleeding. You cut yourself, you bleed.
Mm-hmm.
We don't want you to bleed. So electric razor will work just fine. Fluids, it is very important to drink a lot of fluids, and that is it going to be your full-time job. I already can see that right now.
I got a question. How many bottles of water do you drink during
You're
the day?
way ahead of me. 10 to 12 glasses of water a day. I was just going to tell you that.
Okay.
10,
Yeah,
10 to 12
And I only drink
glasses.
3.
Oh, step up. Okay, what you
I
need
start
to,
feeling,
what do? You kind of like space it through the day. Let me explain you when I'm talking about fluids. Let's define fluids. Water is your best fluid. That's the fluid I prefer you to drink. It's other good fluids too. Jello is a fluid, popsicle is a fluid, juice is a fluid, soup is a fluid. All those can be counted as a fluids. Something cannot be counted as a fluid. I don't say you cannot have it. I'm just saying cannot be counted. Anything with caffeine and caffeinated or alcohol, because what it does, it's pull the fluids out of your body.
I tried that too.
If it,
Drink caffeine and I want to throw up.
then don't do it. But anyway, I'm just saying, if you want it, you can have it. I'm just saying you can't count in those 10 to 12 glasses of water a day because I want you hydrated, not dehydrated.
How many
Yeah.
ounces on the glass of water?
Like 10 to 12. It's an 8-ounce cup. That's
Okay.
it. Yeah,
10
10 to 12.
12
glass.
to 12 to 10 ounces is preferred.
Oh, okay. One glass is 8 ounce.
Yes, ma'am.
Yeah.
Okay.
Most of I can't drink nothing through here because I can't swallow. Most of it's going through my tube.
And it's fantastic, and I'm glad that you have it because do you put your nutrition through this tube? Okay,
Everything goes through.
very good. So you flush the tube, you flush it with water before and after, correct? Okay, so that's count as a fluids. Okay, plus you still have to, but wait, because you don't wanna. Okay, when you put some food in your tummy through the tube, after you put the food, put the water, give a good little couple hours to absorb everything. Then you can give a little bit more water. So through the day, you still continue to give yourself a water. I don't want you to be bloated on the water because you need your nutrition. However, you need to add some extra water and just every couple hours put a little bit in.
Like
Every
last night.
couple hours put a little bit in.
Like last night, I had an accident with it. I never had. And I had to wake up no matter day. I had a bowel moment. I didn't even feel it.
It will, unfortunately, it will happen again. It's not gonna be last time, but we're all gonna get through this.
It's
That's
like,
just-
what was it, about 3-4 days that I got up at 4 o'clock in the morning, a bunch of blood come out, but watery. And then when she was taking me to the hospital at 7 o'clock, clots of blood come out. It looked like chopped liver.
I know, I'm sorry.
Yeah.
It's that's why we need to
That
get you.
really scared me. I don't
No, I
know.
bet it does. I bet it scares you. And so we need to, that's why we're talking about, we gotta get everything together so we can get that treatment started, so we can make you feel better. Okay? So, it gets worse before it gets better. You know. Let's talk about mouth care. Chemotherapy can cause mucositis. Radiation also can cause that too. But mucositis, it's like literally sores. It can be in the mouth. It can be
I don't have
anywhere.
no teeth.
It doesn't matter. It's not a
But
teeth.
she's saying that you
I'm
can
not-
get sores.
Sores. It's
That
not a-
that's
it has
another
nothing to do
that,
with teeth.
that's
So
something
we're
else that
gonna-
could be happening.
So what are we gonna, it's a paper on the back over here. It's called mucositis. And I'm gonna, on the page 3. On the page 3 over here.
Yes,
it's a
ma'am.
specific paper over here.
Mhm.
And I'm gonna, this is my favorite. It's a baking soda and 1 teaspoon of baking soda. You can use salt, you don't have to, but some people do, and it works really well. In 8 ounces of water, this is a solution. And you no, that's,
But he can't drink.
no,
it.
it's not for drinking.
Oh, to rinse
no,
out.
no, it's
To
not
rinse
for
out for-
drinking.
oh,
It's
it's for
just
the-
a rinse, it's just to prevent.
If he gets the sores.
Nope.
To
It's
prevent
not
them.
if-
To prevent them.
It's to prevent them. You
Got
do
it.
this.
Okay.
You do this. Oh, they say 5 to 6 times. I know you're not gonna do it 5 to 6 times. If you're gonna do it at least 3 times a day, I'll be happy. Okay, listen to me. You get up in the morning and go to the bathroom, and you
Rinse
can
out.
rinse your mouth with baking soda. That's once already.
Thank
Before
you.
you go to bed.
Not Listerine?
No, don't you dare. Don't you dare.
That's what I-
No, okay, listen
The
to me.
reason,
It's
listen,
a-
Okay.
it's very
no
important.
no commercial mouthwash, no hydrogen peroxide, no Listerine, no scoop, no, I don't care, none of those.
It's baking
Your
soda.
best friend is right now is baking soda. It's neutralizes bacteria, it helps, it cleans your mouth, and it's prevent mouth sores. It's not for drinking, it's not putting through your tube. It's a simple mouthwash, okay? But you have to do it. You do it in the morning, you do it before you go to bed.
And
That's
do it
twice
during,
already.
and during the day
And
too.
maybe if you can do it once or twice during the day, you make me a very happy person.
Not only that, you won't end up with mouth sores, and then you won't have that pain.
So, because that's painful. If he developed thrush, that's different. Then we would have to treat with some other medicine. Nausea, we're going to prevent his nausea and vomiting. Of course, he's going to get anti-nausea medicine over here. Dr. Mahmoud believe already prescribed something. If he didn't, what pharmacy do you use?
It's Walmart, SPID, and Greenwood.
Walmart. If he hasn't done it yet, I'll do it. If he probably already done it, so it's gonna be composine or pro. You cannot swallow this, right?
Is it something that he's putting in his mouth and it dissolves?
Give me 1 second. I'll hold on. You can't swallow. Forget about it. I'm gonna.
Yeah, that's right.
Oh, that's. Oh, here you go.
There you go.
There you go. I was like, oh, come on.
It was sleeping.
Okay. Let me quick look something up. You are gonna be on. Because that can be changed. Okay. The medicine, the doctor, the anti-nausea medicine over here, he is planning to prescribe him aloxi. Aloxi is the same family as Zofran. That's the one you were talking about, put underneath your tongue. So you can't give him aloxi and Zofran. It doesn't work together. The composine doesn't go here, so it's another medicine. So I'll figure out. We're probably gonna send you. Okay, Dr. Warhe, if you're gonna be with Dr. Warhe, likes to give Zofran. You cannot get Zofran for him because he's gonna be on aloxi. Because, like I said, it's the same medicine. So if please let us take care of his nausea. Okay, if he has a problem with nausea, let me know. Okay.
Okay.
Not Dr. Voorhees. If he has a like oncologist, radiation should take care of all of this, but not nausea. If he has a nausea, please talk to us, and I'll figure out which medicine would work better for him, because he can have a Phenergan, which is liquid, and he can put through the G tube, or we can switch him to the Zofran instead of Aloxi and give him Zofran over here. So I'm gonna talk to Dr. Mahmoud also. Phenergan I like Phenergan, but Phenergan make you extremely sleepy. So I'm not huge fan of the Phenergan. So let me see if we can do Zofran over here, and then he can have a Zofran on his tongue. Okay, so I'll let you know, and I'll make sure I'll take care of this part. Okay, for
Thank you.
anti-nausea.
Yes, ma'am.
And if he has the extra nausea, and if he's doing that, whatever we're going to be doing it, but he still have a nausea, please let us know, because am I even gonna? Are you diabetic? How is the control? Is it the
There's a metformin.
metformin? How your sugar been running? Pretty good. You've been well controlled.
One.
Okay, you've been well controlled diabetic. Okay,
He's been well controlled with his sugar levels for the past month now.
Okay, the reason I'm asking, because he's gonna get some steroids over here with the chemo. Steroids can choose the blood sugar, and the other medicine I was like thinking in my head already can cause like delay nausea, because he looks like he's already prone to nausea. So sometimes it's given with the steroids, but we can try without. I think I'm gonna tweak his treatment a little bit. I'll talk to him.
Thank
because
you.
he is.
He did have an injury, and he did have steroids, and his blood sugar was uncontrolled for about 5 months, and he had
5 ruptured discs.
and he had to go on insulin,
Okay.
and then finally
Who control your blood sugar? Do you have a primary?
it was at that time it was Dr. Alvarezin.
Who do you see right now as a primary?
Now he's gonna see Dr. John Carroll.
Okay. When you go see him,
Yes, ma'am.
please let him know that he is on a chemotherapy, and part of his chemo he gets a dose of the steroids every single so every week he's gonna get 10 milligrams of the dexamethasone. It's a steroid. So he might wanna tweak his diabetic medication. That's gonna be up to him.
Okay.
I would prefer, because he already have let PCP take care of his medical problem. Let Dr. Mahmoud and Dr. Warhead take care of his cancer problem. But we're all going to be together. So as long as we communicated and we're on the same ball game, it works better.
Yes, ma'am.
Okay.
Mm-hmm.
I'll tweak that. Okay, I'll talk to him about that, and I'll see if we can get you something a little bit extra, but we won't give you any extra steroids. Diarrhea or constipation, I have no idea which way it's gonna go. It can go either way. But either way, you need to make sure you drink a lot of fluids, because if you're constipated, you need water. If you have diarrhea, you need water. If you do have diarrhea, it's okay to take Imodium anti-diarrhea medicine over the counter. If you have constipation, okay to take stool softness or whatever works over the counter. If that works, great. If it doesn't work, then you need to let us know. Infection, I already told you. Peripheral neuropathy. That is a huge one, actually, unfortunately. You're already diabetic, you probably already have it, I guarantee you. And Taxol, unfortunately, can make it worse. Taxol, you know what peripheral neuropathy is, that tingling on the hands and feet? Or Taxol, I'm sure you already have it. Taxol can cause that also.
What do you take for your neuropathy?
You should have got some medicine.
He's probably on Neurontin.
No, Gabapentin.
Gabapentin,
Mm-hmm.
That's the same. Okay, Gabapentin. Good. Make sure you take that. Continue if you're tolerating. How much are you? I can look it up. How much are you taking?
I take 2 tablets.
Okay. you're still on a max. It's not max yet, so if it needs to be tweaked, we tweak it. The other thing what you could do to add to it, right on the back, it's vitamin B6, and you need 100 milligrams a day. Vitamin B6 works specifically on the nerve ending. This is not, this is just over the counter, and it actually works too. So vitamin B6 can come in 50 milligrams. That's why I'm writing you. If it's 50, you need 2. If it's 100, you need 1. But that's something you
We
can...
were taking the vitamin B sublingual,
Okay,
but
Keep doing it.
we can put that in the tube, and that'll be the same thing.
that's going to be the same thing.
And it's
Perfect.
B12. It's
And
B12 complex.
B12, it should be, look how much B6 there. You can talk to the pharmacist, and they should be there, but that's fine.
Okay.
Keep doing that.
Okay.
That's good. That's very good. Yeah, that will help. Do you want to talk about sex?
No sex.
Okay, no sex.
We haven't
We
had sex
skip it.
in 6 months.
We'll
We haven't had sex probably in a year.
okay. And if we'll when we get there, if it's open subject, if you want to, we'll talk later. Support group, you have an awesome support group. Look, you're like a lucky man. But American
I
Cancer
used
Society.
to be a very...
American Cancer Society has some support groups also if you're interested. You're going to meet a lot of good people in the chemo too. They're great support. So just let us know because depression is common with the chemotherapy. Never mind the
And
medication, anxiety, all those stuff comes out from nowhere. Never mind, just the word cancer can cause that. Never mind everything else we're going through. So just keep an eye on it and just let us know if we need to tweak it or if we need to do something about it. I think I'm done. I don't want to tell you anything else unless you have a questions for me. Do you have a questions
How
for me?
long is it gonna take me to get well?
Let me see. Let me pull my magic ball.
You don't know. You don't know the answer to that. I can tell by the way
I'm
you
not.
answer.
I am. I'm not even going to try to say it. I would be lying if I tell you any numbers, and I'm not the type. I want to be very open and very honest, and that's why I spend some time.
I just wasted all this burping and bubbling and like it's
This is just what it
mucus. It chokes me.
I
Like
know.
right now.
Yeah.
It's choking me.
All right. If you don't have any other questions for me, I'm pretty much done talking to you. If you don't have any questions for me, do you have any questions for me? I'm done. That's all I wanted to tell you.
Yeah.
It's more information over here. What I did, I pulled the most important stuff because otherwise it's
You're right.
overwhelming.
Yeah.
So in the nighttime, later on, when everything is low, I will replay it. And all right, okay, tomorrow I gotta go buy the baking soda and the B6. We gotta be ready with stool softeners. We gotta be ready with anti-nausea
Which is I'm
liquids,
gonna
and we can put it through the tube.
now talking about anti-nausea. You do not need to take anti-nausea
Not unless he's there.
unless it's there.
These are just gonna be medications that are gonna be ready in case we have that. The
Correct.
baking soda is gonna.
That's prevent.
That we're
That's your
definitely
start right away.
that we're gonna start doing because we're not gonna deal with mouth sores. We're gonna make this chemo process smooth sailing as much
Correct.
as we possibly can.
Absolutely, absolutely. So before you come for the treatment, you do not need to take anti-nausea medicine because you're gonna get it. So, but we will send or I'll
And the
check it out.
anti-nausea medicine, it's gonna be administered by you and not by the radiation doctor.
No, it's he's gonna get here.
Right,
Yeah.
and not the radiation doctor.
Correct.
And if the radiation doctor wants to prescribe it, no, the Dr.
Dr.
Mahmoud is gonna be
will take care
prescribed.
of the
I got a
correct.
question.
However, if something going on like during radiation with
yes,
the
ma'am.
mouth, with the esophagus, and everything else, whatever he's gonna tell, he override me.
Okay, and then Mr. Felix has a
I got a
question.
question.
Yes.
How will you know if the chemo's working for me instead of going to the radiation? Or am I gonna have both of them?
like I said, your chemo works together with radiation. Your chemo is gonna make radiation work better. That's the whole idea.
That's what I didn't understand.
Yeah. So it's together with it. That's why I said like we gotta make sure you start on radiation so we can start the chemo, because the chemo gonna make radiation work better. Make a little bit sense?
Yes.
Because it was another big treatment. I like he was mentioning like, but you too weak right now to. He was mentioning cisplatin. I'm not gonna go ahead. Don't worry about it. That's what they decide. They decide to go with the chemo and radiation, which is a very good plan. It's an awesome plan. Okay. Any other questions? Okay. Would you like to give me an autograph that you pretend that you listen?
No, I listen to everything. Very nice.
Just signed over here that what are you signing that I'm actually giving you those papers, and that's why I keep this paper, because otherwise I can talk forever. I used to be I just become nurse practitioner. I was Dr. Mahmoud infusion nurse. I've been doing all those infusion. That's why I'm talking from my heart. So I know what works and I know what doesn't. So I've been his infusion nurse for past 14 years.
Awesome.
So I used to
That's good.
poison people. Now I just talk to them.
So that's good. That's good.
So, all right, Felix.
Well, I'm just gonna have to go home and shave all of this off. Yeah, I don't want to see it fall off. I'll shave it.
Wait.
It'll come back. It'll come back.
It does come back. You're absolutely right. It will come
It-
back.
it
It
will
will
come
come
back.
back. You know what? It might come back different color. You might be redhead.
I doubt that. Well, I don't
Wait,
doubt it.
don't-
You don't
I
have,
don't doubt it
don't
because
doubt it.
my aunt was
You can sign it
redhead.
too. Is it?